there's just so much.
You're listening to a Mamma Mia podcast.
Often a lot of people, especially if they're deep in addiction, they need those firm boundaries. And they're always going to feel tough to you and the other person because you're doing the right thing. That part where they're pulling on emotional strings also is why many people who have friends or family who have got addiction problems feel this manipulation, you're being gaslit and you're helping someone, but you also feel deep down that this is not right and you are enabling.
Hello there, welcome to Well. I'm Claire Murphy.
And I'm Dr Mariam.
We're discussing how to love and support someone navigating the challenges of an addiction
Today, it's not an easy thing to support someone going through it, whatever their vice might be. Alcohol, drugs, gambling, even shopping, and nowadays digital devices too is quite an addiction. Because we humans are very, very good at getting addicted to things and not very good at unaddicting ourselves to things without a hell of a lot of help. So we're speaking to Dr Mulenga today, who I understand is a very good friend of yours, Dr Mariam. We're going to try and find some strategies that will help us navigate the minefield of addiction. We're also going to finally answer Kara's question. I don't know if you remember a few weeks ago, I mentioned there was a message from Kara and she said she loved our report.
Oh,
Thanks,
love it.
Kara. She had a question. So it's finally your time to shine, girlfriend. And she wants to know about whether to hysterectomy or to not hysterectomy today.
That is the question.
That is the question. But next, med school time in Mariam. This one is for anyone who was ever made to lay flat on your back, legs akimbo, to have a baby.
Welcome to med school.
Okay, what position were you in when you had your babies?
Yes.
Plural.
Yes. So I was in that typical semi-reclined position that most hospitals still use.
Yep.
Like lying back but slightly propped up. And it felt like at the time, even though I'm aware there are other different positions, others which are probably a little bit more helpful, it felt like it was just kind of sit here.
Expected.
Yeah, expected. And no one really offered me alternatives or talked me through options. And when you're in such a vulnerable state, you're just like, go with it, you know?
Yeah, exactly. I was on a fitness ball on the side of the bed and I was quite comfortable there. And then my midwife yelled at me to get on the bed because she had to put a monitor on. And I felt like I didn't have any choice.
I threw up in that semi-reclined position.
So did I.
Projectile vomited onto the obstetrician.
Oh, on the obstetrician?
It was everything was happening.
Yes, I was sucking on gas and then I spewed at the same time.
He got all my fluids.
Great. I mean, he's earned it, let's be honest. But there is a hospital in northern Ecuador who back in 2007 created the world's first ever vertical birthing room.
Oh, tell me more.
This is not like a ride at the show. It sounds like it. It is not. It was built to better integrate Indigenous women's birth practices and enable them to feel safe and respected as they gave birth in line with cultural traditions. Because in Western medicine, while we've come some way into giving women different options for birth, like water births that are offered in some hospitals now, we as a general rule birth on our backs with our legs spread. The popularity of this position, and this is going to make some people mad because this might be the first time you've heard this. This is not the first time I've heard this and it made me mad the first time. It's been credited to French royalty because King Louis XIV of France, who reigned from 1643 to 1715, reportedly really preferred watching his wives and mistresses give birth in a way that he could best see. And so that meant them lying on their backs with their legs akimbo.
So this is where it started.
This is where it started. Because before that, apparently, we would use gravity in ways to get babies out a little bit more efficiently.
Makes sense.
Makes sense, yes. This preference, according to historians, inspired doctors and society to popularise that lying down position, which gradually became the norm in France, and then that spread across Europe and various other countries. But most ancient and traditional cultures encouraged upright, squatting or birth chair positions for delivery, and as I said, makes use of gravity to aid labour. And this is what the Ottavolo Hospital included in their vertical birthing suite. So it has ropes and bars to hang on to.
I love this.
There's like a woman who is demonstrating in a video that I watched, and she kind of walks up to a wall and she's kneeling on it with her legs apart and hanging onto a couple of ropes and a bar from the ceiling so she can support her own weight. But then gravity is doing its thing.
So good.
And allowing the baby to come out in that direction.
Makes sense from a physiological point of view. Upright positions. Gravity, you're opening your pelvis, make labour shorter and smoother.
Yeah.
So we should be doing this. We should be incorporating this.
Or at least investigating it to see if it's a good option for us. Yeah, because, I mean, would my coccyx bone be in several pieces? after birth if I had done it that way? Who knows?
Who knows?
We don't know.
But this is why a lot of people also give birth when they're on the toilet, right?
Yes.
Yeah. So
it seems like a position that your body's like, okay, we're
yeah,
good to go.
yeah.
And I've just literally this morning watched a video of a woman walking into the hospital because her husband had to park the car and gave birth in the car park, and she was standing up and just caught it. Let's maybe investigate giving birth in ways where gravity is a little bit more of an assistance.
This is all freaking me out, thinking that I'm going to be giving birth soon.
Yeah, you will be. How exciting.
Yeah, I'll try this vertical position.
I mean, we can install some ropes and bars for you if you like. See how you go.
Yeah.
You can report back.
Yeah.
All right, check-up time next. Let's get into the tough calls when it comes to loving someone who has an addiction.
It's time for the checkup.
Mariam, have you got anyone around you in your life who's had issues with substance abuse?
I think many of us, whether personally or professionally, have seen the impact of addiction up close. It's definitely taught me that addiction doesn't discriminate. During my time, I will share this story, as a junior doctor, I'll never forget this one moment on a vascular surgery rotation. We'd just done my first ever below-the-knee amputation for a patient who'd lost circulation after years of heavy smoking. It's a really confronting surgery, to say the least. And the next morning, I was walking into my shift into the hospital, and they were outside in a wheelchair.
Oh, having a cigarette.
Smoking a cigarette.
Yeah. Mm-hmm.
And it just hit me, not in judgment, but in realisation that this is what addiction looks like. It's not just about willpower or choice. It's how deeply the brain can hold on to something even when they know it's causing harm. Mm-hmm. And that moment really shaped how I see addiction, not as a weakness, but as something that deserves a bit more compassion, understanding and proper support, because no one chooses that kind of struggle.
Exactly. No one is judged more than a pregnant woman suffering from substance abuse issues.
Yeah.
Because you're held up on this kind of pedestal that you're supposed to be some kind of pure, clean vessel for this baby to grow in. And yes, ideally you want to nourish that baby. And I can't think of too many women who are not wanting that. But if you have a substance abuse issue,
It's hard.
that is a really hard thing to overcome. And, you know, let's try and put our judgments aside maybe and help people a little more. I do have a friend who's been really open about her alcohol addiction. She's actually spoken to me before as I've been the host of the Quickie, talking me through some of her experiences. If you want to have a listen, we'll pop a link to that in our show notes. But she disappeared from my life for a few years, and this was despite me regularly trying to reach out to her and find out how she was going. And when she did come back into my life, she sat me down and really downloaded her experience with alcohol addiction. And I was just so floored by how it had controlled her and the decisions it had led her to make. And it was devastating. And I'm realizing how lucky I am to still have her in existence, as well as having her in my life. And for her to come out of the other side of that, I've understood the absolute strength and resilience it's taken for her to get to this point.
Yeah.
It's not up to me to tell her stories, and go and have a listen to the Quickie if you want to hear that. But the strength this woman has is just mind-blowing. And I don't know if I would have had the will to be able to make it through what she's made it through. So I get a better understanding of what it is now, because I haven't always been understanding of substance abuse issues. Because I don't have one, I've found myself a little bit judgy at times. I mean, why can't you just stop?
Yeah.
It is not that easy, obviously. But Mariam, how do you even begin to start helping someone who's in the grips of addiction?
The truth is, you don't have to have all the answers, and you don't have to fix them.
That's a thing, right?
That's the thing, right? So we know addiction is a complex medical condition. It's not a character flaw. The first step is actually connection with that person. Let them know that you see them, you care, and you're there without judgment. Sometimes that simple act of saying, I'm worried about you and I want to help when you're ready, that can plant the seed for change, right? The next step is information and support for yourself. So in Australia, every state has an alcohol and drug helpline, ADIS in New South Wales. The services don't just help the person using, they support families and friends as well. So they can guide you on safe ways to talk about treatment, what services are nearby, and how to cope yourself. Because obviously for friends and family, it is a difficult path to walk as well. And there's The GP. I can't stress this enough. A good GP is often the best first medical step you can take. We can check health risks, manage withdrawal safely, and connect someone with counselling, detox or rehab. You don't need a formal plan to walk in and start the conversation. And sometimes, having that support person that you connect with and don't feel like they're judging you and going into this conversation with a GP is really helpful. And I've had a few patients coming with a friend or a family member, and that conversation has just gone so much better because they have that support person there with them.
Yeah.
But here's the emotional side. You can't force someone to get help before they're ready. What you can do is stay steady, keep the door open, and make sure you're being looked after as well, because supporting someone in addiction can be exhausting and heartbreaking, and you need support as well. So to begin helping, start with compassion, small conversations, and knowing where to get backup when needed. Recovery, it's not a straight line, but no one has to walk it alone.
What does the referral process look like if you're not the person coming forward with the issue? So can you help someone get a referral? Can you force someone?
Yeah, in Australia, you don't always need a GP referral to start the process, but having one can help. So generally, we always say, if you're worried about someone, just say, let's just go into the GP together and start a conversation, go from there. And a GP can assess the situation, rule out any urgent medical risks, connect you with the right services so you don't have to make that decision yourself. They can also write a mental health care plan if that's needed, or a referral letter for other certain programs that might help the person. We spoke about pathways in our previous potties, public rehab and private rehab services. Public rehab funded, lower costs, but wait times can be long, unfortunately. But entry usually starts with a call to the alcohol and drug services in your state, and they'll do an intake assessment and guide you to detox or rehab. For private rehab, obviously they're faster to access, but they do come at a cost. Some health funds, if you have private health insurance, may cover part of the stay, and you can self-refer or go through a GP for that step as well. A really important step is detox. So most programs want someone to complete a supervised detox program before starting rehab. That can be done in the hospital or community withdrawal unit, or even at home. And we generally encourage that if they've got medical support at home, depending on the situation.
And can you go in with someone when they're in that situation and kind of sit with them and help them through that process?
Yes, definitely. So you want that support around you. If you're wanting to start rehab and get through addiction, you're going to need all the support possible. Yeah. And I think having friends and family with that compassion and understanding, it's a really important part of the equation, because you can't do it alone.
Yeah.
Just want to end with the tough part, unfortunately. Even if you're desperate for someone to get help, which I'm sure many people that care about their friend or family member are in that position, the person themselves usually has to agree to go. And it's most effective. We know rehab is most effective when it's voluntary. So what you can do is encourage, provide information, and link them in with services when they're ready.
On the way, Dr. Xavier Mulenga is going to help us better understand how to confront someone in our life dealing with this, because that's often the first hurdle we come to is when people don't want to admit that maybe there's a problem going on. We're going to find out how to best support them and when to know when you just can't do any more.
Quick question. Are you tired of the news? Do you want a podcast that isn't self-improvement? Come get unleashed. It's funny.
I also think that underwear is sort of almost like a new marriage. Like it starts off, it gives you the best of what it offers at the beginning.
It's unhinged.
I have a bit of a thing for my friend's husband's salami.
Oh, hello.
It's not here to teach you anything.
I need to make sure he looks at me. One side, I'm going to make a sign. This is what I married because I didn't meet you in time.
Yeah, right.
The other side, with pointing to my son who's 12, look what we could have had, Lewis.
Yeah, I love it.
It's a good time for Gen X. So search Unleashed wherever you get your podcasts. New episodes every Tuesday.
Dr. Xavier Mulenga is a psychiatrist who has subspecialty training in addictions, and we started off asking him the best way to take the first steps and speak to someone in your life who might be struggling with addiction. I think we want to know, How do we confront someone, if we know or if we suspect that they have a problem with addiction? How do you even start a conversation with someone around something as emotionally minefielded as this?
I think just look at it as any crisis you have in any family unit where you have to sit down and voice your concerns. And it's also good with addiction because usually a lot of people do get defensive and might not want to admit the first time you do bring it to them. Maybe have some objective markers of things you've noticed as well. Because often, I guess, it starts off with a vague feeling that they know something is wrong and the person's being inconsistent. It's just these vague things, but we put it up to the usual life things, like someone could be stressed, might have something in their life or something that we can't see going on. So I think we tend to even do these confrontations or interventions at a bit later stage. And if you have a strong suspicion, you've found evidence to say if they're alcoholic, because that's the most common addiction we have people deal with. If you find bottles everywhere, always hungover, missing things, then you can ask, I think maybe this might be alcohol, or even other drugs. Some people find drug equipment. So, if people are shooting up drugs, you find needles, meth pipes, that sort of thing. Then you sort of have more data. But most people usually come with vague ideas. And then from then on, how they engaged in that conversation is going to determine how further along you go. But a couple of things that do help are maybe reading a bit more about it. Just even going on YouTube, lots of videos, but things like Al Anon. So that's like for our families or carers of people or friends of people who have alcohol addiction. And they have lots of resources online. You can call them, engage with them, and they can give you strategies. So you probably need professional help or some organization. There's also the Family Drug Service. I think it's FDS. If you just Google it in Australia, it give you the hotline, 24-hour number, lots of resources on the website, different drugs, different ideas. But then you just actually getting your own help external of the person. The last point I'll also put there is the person has to be ready to change. Let's say you sit down, you both agree I've got a problem. They agree with your problem. Where do you go to from here? If you're doing more work than the person who has the addiction, you're doing it wrong. And that's what a lot of us like doing. So I'll book this appointment for you. I'll do this. You should go. I'll reschedule this and that for a psychiatrist. And you can do it a few times. But I often tell people if you're doing it with no avail, you should actually just stop.
Well, that leads me directly into my next question, because this is something that I've seen firsthand with families dealing with someone having an addiction is they don't know the line between helping and enabling. How do you identify that line? Because you want to help your person if they are in trouble, say legally, or if they are financially in trouble, or, you want to help them. You don't want them to be in danger. But how do you draw the line between helping and enabling?
Ooh, that one's a good one because it's always subjective. So the very common examples I give, the way a parent will engage with their kid versus the way a husband or wife would do it versus the children or your friends will draw the line. They will draw it differently. I should say mothers and wives probably draw the line far further on than they should, mostly because of the nature of, moms have very strong attachment to children. So, doctor, I'm just helping my son. How can you tell me I have to kick him out the home? Is my son or my daughter? So you find that the lines are shaped quite differently across all those different groups. So often I say to people, if you find your mental health or you're going downhill as well, then you've probably crossed this mark and you need to step a few steps back. And I think even though addiction, people murder the lines, like, no, it's an addictive process. They're just doing it because they can't. We actually enable them by infantilizing patients or clients with addiction issues. So that's a good line if you're going downhill. Or if you yourself start going into the addiction space as well. So it's not uncommon that someone who's living with alcoholic starts increasing their alcohol use. They might not reach alcoholic levels, or some do, but definitely they reach problematic use of the substance or drug, whether it's cannabis now we're both smoking. That's also another sign. And I think, generally speaking, if the person is not helping at all and you're thinking about cutting off and putting a boundary, that's probably hard to stop, but that means something already, you've done your best and you can probably step back.
Can I ask about things that maybe we shouldn't do when we're dealing with someone who has an addiction? Like, I know a friend of mine was struggling with their partner having an addiction, so she kind of laid out an ultimatum. Like, if you do not get sober, then, and there were repercussions, not seeing the children, not living in the family home, lots of things like that. Is that a way to handle it, like really drawing the line? Because how do you know if it's a boundary or if it's an ultimatum and things are going a bit too far?
I feel this is when it's good to get some outside help, whether you're seeking a therapist for yourself. Some people actually ask their therapist, or you're going to therapy, or you're going to these groups I've recommended, or there are a lot of organizations that can actually talk to people who actually have partners or children or someone you love who has an addiction problem, because you normally won't be able to draw that distinction quite well. And often I'm a big proponent, and especially in a lot of addiction psychiatry, I think people think we're very, very tough doctors in a way, because often I tell clients that, maybe this person should be kicked out of the house. Do you want someone who's got drug issues are senior children? Because that's how they pick it up as well. And also there are people who been alcoholics who drink driving your kids around. So I guess where are you going to draw that line? Because I think it sounds harsh, but often a lot of people, especially if they're deep in addiction, they need those firm boundaries. And they're always going to feel tough to you and the other person because you're doing the right thing. It's almost like when you've got a kid who wants to eat candy all day and you say, no, they can't. Because you're thinking the same thing, candy is that drug or alcohol. They'll put a fight. They'll be trying to find ways to get the candy. They'll be saying, oh, mom, please, or I need the candy. But they can't have candy every day. That part where they're pulling on emotional strings also is why many people who have friends or family who have got addiction problems feel this manipulation, you're being gaslit and you're helping someone, but you also feel deep down that this is not right and you are enabling. A lot of people know it, but confronting it is difficult. So often I tend to be big on having family meetings or meetings with the carers or whoever's in their life, person of interest. And they ask me that question a lot. And I say, maybe this person shouldn't live together. And also it's very surprising because the patient will be like, Doctor, aren't you supposed to be advocating for me? Or the other person is like, where are they going to go? You're going to make them homeless? And I'm like, well, if you're both sinking in this ship, it's better maybe one person sinks, which sounds still harsh at the end of the day. But I think it's like, if you're telling me that this chaos in the home is what you're going to deal with and you're not even sure when recovery is going to happen, well, you're taking a big gamble hoping that things will change. To get to see an addiction psychiatrist takes so long. By the time they're seeing me, they already should have made that choice a long time. So it's easier for me to tell them to take a step back. And sometimes people need someone else to say it. That way they feel more empowered.
How do we tell when we are at that stage? Like, how do we know when our person is in crisis to the point that we do need professional help? What are some of the signs we should be looking out for?
Get professional help as soon as possible.
Right. So it doesn't need to get bad. Just get into it straight up.
And that's the problem with maybe even addictions, or even mental health in general. People wait a long time before they get help. So I often say there's no too early point, as soon as possible. So a good starting point is the GP, maybe going to the GP together. The GPs are very well versed in addictions. They're the ones who make referrals to see me or other psychologists. So the GPs have got lots of resources. Some GPs are actually trained enough to actually manage mild addiction issues on their own and they treat many people with alcoholism, meth addiction, cocaine addiction. If anything, they probably treat more than I do because most people see their GP, most people aren't seeing a psychiatrist. So I think seeking professional help early, regardless. Let's say if you find someone who's drinking, you find a bottle, you have an intervention, you should already making a plan to go see a doctor in the hopes of getting maybe blood tests, see is it causing any problems, get the doctor to do an assessment. And often I tell people it's good asking maybe the receptionist of a GP practice which GPs are good with addictions. Because some GPs have got special interests in skin, cardiology, maybe weight loss, and then some addictions, and you want that person. But most GPs can do it, to be honest, because all of them meet clients. There are very few GPs who, in their practice, won't meet clients who have addiction issues.
When you are in the spiral with somebody who is dealing with addiction, it is incredibly difficult to step away from it and cut ties if that's necessary or remove someone from your physical space. Like, how do you not get caught up in the chaos of it all?
That one is very hard, I think, because it usually depends on how good the person is at setting boundaries for themselves. People who are good with the boundaries are someone, let's say, parents who come and, let's say, pick up their child from their home and present them to a clinic, but won't let this person into their home. So then when I see those parents, I say, they've probably tried that before. It's not the first time, but they have the boundaries that we'll come to you and help you there, but you can't come into our space. Then there are other people who I've had parents who have sent me like, oh, my child assaulted me, here are the pictures, but they still have to live with me, otherwise they're homeless. So that in my mind, I'm like, ooh, you should already not be with this person, but that's your child. So I find that it depends a lot on what the person who's coming asking the question is. And I think that's the sort of the tricky part because it's all about boundary setting. So I often tell people, if you say the word boundary, it sounds less like, oh, I'm abandoning this person. So I say the boundary for you is even simple things. What's your sleep like when someone's addictions are in the house with chaos? But you need to protect your sleep because sleep is important. So I use other things as a way to distance themselves from this person's bad for me. I'm pushing them away because that's what people feel. They feel like they're abandoning them. And inversely, that's why a lot of people with addiction issues who don't get help do end up being isolated, lonely people because other people can't have them in that space. So boundaries is probably the word I'd use.
Say if it's mum or dad who has the addiction issue and they have small children, how do you explain to kids what's going on with one of their parents? Do you tell them the full truth and kind of allow them to process it? Do you try and shield them from it?
That's a good question. Let me ask you a question just generally. If I had to tell you to guess, what's a good age you can tell children the truth about, let's say, one of the parents has an addiction problem, what would you think is for the general public would be a good age to tell kids the whole truth? What's a good age, you think?
I'm a big advocate of always telling kids the truth regardless of their age, but it has to be age specific. Like it can't give the nitty gritties at 5, but you can give them a basic idea of what's happening.
Yes, and I'm the same. It's at any point and make it age appropriate. And there are different organizations that can tell you that. And even if you just Google and YouTube, and I think the big thing as well is, let me give you an example. One of the cases I got was a client who didn't want to tell that child that they had, drinking problems, even though I think the child was maybe 7 or 8 years old, was actually emptying bottles of alcohol from the house and trying to throw them out the house because this kid just knew this was bad. So imagine 8 years old. And the person thought, oh, they're too young, doctor, to know this and to have this discussion. But I said, but your child is literally emptying alcohol bottles from your home. 8-year-olds.
They know more than you think they do.
Exactly. And I think a lot of people with addiction think they're hiding things. And they're not. So even people say, I'm a functional alcoholic, no one knows at work. I'm always saying someone probably does, but maybe your work hasn't reached the level that someone can complain or they don't want to be the first to talk to you about it. And even then, I also think that's a sign of how maybe this person has got people care about them, to call them in and say, hey, you're coming to work a bit hungover, you're coming late, it's not looking good for the boss. Those people are cruising and, I'm functional, no one knows, doc. I always think, even when I meet them, I think I can tell, and I've just met them that first day. People who've seen them every single day, it's the small things that work falls off, they get delayed, in terms of deadlines. It's always the small things and they add up and eventually they'll come and say, oh, I just got let go. And sometimes people are a bit minimize why they got let go. And I don't need to always probe, but I can always make assumptions. But I do ask, like, do you think maybe your drug use or alcohol use factored into that? So there's always that in mind when I'm thinking about those situations. But so going back to what you said, tell the kids at any point. And it's good to actually, too, as parents, have had that discussion if you can. It's not always easy. But usually by the time they're teenagers, tell them everything. They already know.
Yeah. Plus, they've been on YouTube themselves by then.
YouTube, TikTok, they know.
Yeah, they know. So I guess we've talked quite a bit about confronting the addiction sort of for the first time, but as it's pretty clear, addiction is not a one-step process and there is often relapse and then we have to kind of start over again. How do you support somebody who is relapsed? Because I understand there's a lot of shame involved in that as well, and there's people feel like they can't do it again. And so how do you support someone who has relapsed and we're sort of starting from scratch again?
I guess everyone should make a cutoff for themselves. Because let's say a lot of clients, if you ask me the average months or years it takes before I see someone enter fully good, maybe complete sobriety or abstinence phase, whatever it looked like with their drug of choice, I often now say it's like if they're engaged, it might be a 2-year journey, 1 to 2 years. So then I have to ask the person, do you have 1 to 2 years of relapse in you? That's already another first question. So you have to gauge how much fuel is in the tank. And that's even a question I do. Because I have lots of family meetings, because I meet lots of people with addiction issues. And I'm very big on bring the family, bring your wife, bring, if the kids are adults, bring them in. Let's have a chat together. Obviously with varying effect, not everyone wants to do that. But a big question I ask is, when we make a plan and things are good, because we have a detox in private practice, so they come in for 3 weeks or 4 weeks, they're coming out, and I say, all right. But I ask the question, suppose we made this plan, follow up, this medication, and this person relapses shortly after. I always ask the client, what are they going to do if they relapse quickly? And I always ask the family or the support person. And that's very telling. I also ask as well, how much fuel is in the tank? Because addiction is a relapse and, it's going through relapse and remission states. And people always ask, how do I know if this is the time they're really going to be motivated? We can't really pin that time. And even as doctors, we don't promise anything because addictions, you can't make promises because someone can be sober for 10 years, then relapse and become alcoholic for the rest of their life. So, addiction is almost always there in the background. So usually it's like, how much fuel in the tank do you have? It's going to be a year of this or 2 years. And then better still, what are you going to have to do to protect yourself if it's going to be 2 years? Because if you tell them 2 years, I like using the bigger number because then people think 2 years of this. I can live in someone's same house 2 years of this. Okay, that's good. I think it's easier for you then to make those boundaries when you think 2 years, because people look at me and say, oh, I was thinking maybe 3 or 6 months. And I said, no, 2 years. And that's if the client is engaging properly while they're relapsing. Because a lot of people relapse, vanish for a year or two, then they come back and see me as if nothing happened. I said, oh, I only saw you 2 years ago. You meant to follow up with me a few months after that last appointment. And you don't obviously shame them or guilt them because the win for addiction psychiatrists is someone walks through the door. Because if we had to pin our victories on patient outcomes, it'd be more humbling. I think we'd be a bit depressed sometimes. But I should say most people who engage with addiction services or GP psychologists do better than people who don't. So even though people think my job is quite doom and gloom, most of my clients get better with treatment. Sure, the varying degrees of better is different. I think the part that I often tell families or friends is that this person might get better, but not in your timeline. So that's usually like a good indicator. 2 years of the same thing, what's happening right now, don't think of recovery, like 2 years of what's already happening now, then it would be easy for you to set those boundaries, I think.
If you have someone in your life who's dealing with something like we've talked about today, look, we see you. It is really, really hard to know the difference between helping and enabling.
Yeah.
And we hope that you're not being too hard on yourself, because I've seen people who've had to stop helping. That is probably, especially when it's been their children, the hardest thing they've ever had to do is stop.
Knowing when to take that step back. And I'll just add here, like, I really encourage these people to seek support. You can't do this alone. You also need support. Start with having a conversation with your GP or reaching out to those lines that we mentioned. They're not just for addicts, they're also for family and friends, supporting people through addiction. And yes, just ensuring that you have services to connect with as well, because it's hard. And I can't imagine how difficult it would be for any mother or father to watch their child go through addiction, not be able to do anything about it.
Yeah. That would be heartbreaking.
It would be heartbreaking.
So look after yourself.
Look after
as
yourself.
well as your person.
Yeah.
Next, it is quick consult time. Kara's question is up today. She needs some help with making a very big decision about her future. It's time to get into Dr. Mariam's consultation rooms to answer your questions. Do the honours, please, Doctor.
The doctor will see you now, just through here to consult room 1.
Thanks for waiting. How can I help you?
Okay, remember a few weeks back when Kara messaged us to say she loved our report and I said she had a question. Now is your time, Kara.
Hi, I'm 46 and I've been diagnosed with endometriosis. And as a result, I have pretty full-on menstrual cycle. Bleeding can last for up to 26 days. And it's heavy for about 4 or 5 of those days. And I've got pretty bad severe cramping and breast tenderness during this period. I'm currently on the mini pill because the standard one gives me migraines. And that's actually overall why I'm considering going down the hysterectomy route, just to stop my periods altogether. So I just want to know, what are the advantages and disadvantages of a hysterectomy? And what's the recovery like? And overall, how will this impact my menopause?
Yeah, that's a tough one. So thank you for sharing that, Kara. What you're describing is not just inconvenient, it's completely debilitating. And I'll say up front, you're not alone. Unfortunately, 1 in 9 Australian women are diagnosed with endo before the age of 44, and heavy menstrual bleeding is one of the most common reasons women in Australia see their GP or gynecologist. So let's unpack hysterectomy, pros, cons, and what it might mean at the stage of your life. So benefits. So we know a hysterectomy will stop periods permanently for someone like Kara, who's losing almost an entire month to bleeding. So I can't imagine the effects that would have on her. That could be life-changing.
I mean, exhausting.
Yeah, she'd definitely have iron deficiency, or she should get that investigated.
Get that checked.
If cramps and pelvic pain are mostly driven by the uterus, removing it often will give the patient huge relief. It also means no risk of pregnancy and no need for contraception. That's always great for people who want that. And for endometriosis, if the disease is mainly affecting the uterus lining, then symptoms can improve.
So because endo can be in a whole bunch of places.
Yeah, that's right. But if it is in the uterus lining, then it will help with the symptoms. The challenges, however, it's a major surgery. So like any operations, they come with risks. So bleeding, infection, injury to nearby organs like the bladder or bowel, and blood clots. Recovery would usually take about 4 to 6 weeks before you can get back to your normal activities.
Is this one of those you can't drive for 6 weeks after kind of vibes?
It all depends, I guess, on how the surgery went, if there were any complications. Usually the decision's made with the gynecologist and your insurance. Some women bounce back quicker, but others need a little bit longer, and that's okay. A hysterectomy isn't always a cure for endometriosis. We know that. It's a common misconception. If there are implants outside the uterus, for example, if you've got them on your bowel or ovaries, then the pain will still continue, okay? And then there's menopause. So if your ovaries are removed along with the uterus, you'll go into surgical menopause immediately. This means hot flushes, night sweats, or the shebang if you have the ovaries removed at the same time. But if your ovaries are left in place, you will still go through menopause naturally. But they think that might happen a little earlier than average with people who have hysterectomy. I think it's really important to say that a hysterectomy isn't about giving up. It's a valid evidence-based option when other treatments have failed or side effects are hard to live with. But it's also not the only path. There are medical therapies, hormonal devices, and targeted surgery for endo implants that could be considered as well. So the takeaway from this would be it can be a life-changing surgery for women with heavy bleeding and severe pain, but it's a major surgery as well. And the decision needs a thoughtful chat with a specialised gynecologist who knows your history really well. So, Cara, what you're going through is not normal and you don't have to put up with it. There are options, hysterectomy being one of them. But the best decision is the one made with the right information and right support and a specialist who's willing to talk you through with all the risks and benefits for you. Yeah.
Well, Cara, good luck, friend. We hope you can get that fixed
you
become pain-free sooner rather than later.
Wishing you all the best, Cara.
Yeah, good luck. Also, here is where I insert the general information alert. I feel like we need some kind of siren or something to tell you, this is coming now. Everything you've heard here today is not specific for your situation, so make sure you take what you've learned, use it as the basis for questions for your own GP or healthcare professional. Next week, we're sharing a no-filter episode with author and health coach Sarah Rusbatch about a phenomenon known as grey area drinking. She shares her own journey around her dysfunctional relationship with alcohol, how hard it can be to be sober, and how good it can be on the other side without being preachy. So if you're sober, curious, or even wondering if you're in grey area territory, it's definitely worth a listen. Have a top day. We'll catch you for your appointment next week.
Bye-bye.
Well is produced by me, Claire Murphy, and our senior producer, Sally Best, with audio production by Scott Stronach, video production by Julian Rosario, and social production by Ellie Moore. If this topic has raised some concerns for you, please contact your GP or call the National Alcohol and Other Drug Hotline. You can get them on 1800 250 015. Mamma Mia acknowledges the traditional owners of the land we've recorded this podcast on, the Gadigal people of the Eora Nation and the Wonnarua people. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander cultures.